So this is an example of a care path. So essentially you can do several things through care paths. The most appropriate thing for physicians is really in relation to dosimetry and physics, but you can also do things with billing, insurance, as well as timeouts and things for the therapists that are integrated into these. But essentially the process at Northeast is that a care path is dropped at the time of simulation, and it's dependent upon what type of plan is being generated. So for this is a patient with prostate cancer, so an IMRT plan is dropped. What that generates is a series of tasks that really direct the flow of the patient from sim all the way to through treatment, and generates several tasks for both the physician. So automatically generates a contouring task. Once the contouring task is complete, it goes back to dosimetry to review and finish any normal structures. It also generates a task to peer review those contours. So if you're at a multi-physician site, instead of having to assign tasks to certain people, it will automatically drop that task. Once the plan is ready, it'll drop a task for the MD to review that plan, sign off on it. That will generate tasks for the dosimetrist to print it. The peer review task will be dropped. The QA task for physics will be dropped. And what this does, it may not look like it increases efficiency for physicians, but the biggest thing it does is generate tasks in this window within ARIA that really allow for launching of tasks automatically. So I can automatically launch this plan review task. It goes straight into plan evaluation instead of me having to open the patient, go to plan evaluation. I go into the plan, look at the plan, and once I'm finished, instead of emailing the dosimetrist or checking off that task or writing them a note, all I have to do to finish that task is push done. It automatically goes to the next step. If I want to write a note, I can add a note here, but I don't have to do that. So instead of me emailing the dosimetrist or checking off the task in the task window, which I find very inefficient, all I have to do is click done and it automatically goes back to the dosimetrist. I feel like that saves quite a bit of time instead of having to communicate back and forth. Dosimetry doesn't have to let physics know when it's ready to QA. It's automatically generated for them. Peer review tasks are automatically generated instead of having to keep a list or email Ben to check my contours. It's automatically generated. So that will be coming again to LCI clinics other than Northeast. I know Cornell is working on that, but also wanted to introduce that concept for non-LCI clinics, especially ones that have ARIA coming on board, maybe to consider setting those up through your clinical directors, and certainly we'd be happy to help with that process.